Okay, future rockstar nurses, let's dive into a super important topic for your NCLEX success. Platelets. Grab your coffee, take a deep breath, and let's make this stick. So what exactly are platelets? Think of them as the emergency response team for your blood vessels. They aren't even whole cells. They're tiny, irregular-shaped fragments broken off from giant cells called megakaryocytes, which live in your bone marrow. Pretty cool, right? They only live for about 7 to 10 days, so your body is constantly making more. And their main job? Hemostasis. That's the fancy word for stopping bleeding. When you get a cut, or there's damage to a blood vessel wall, platelets are the first ones on the scene. They rush to the injury site, stick together, and form a temporary plug. Think of them like tiny sandbags plugging a leak. This initial plug then helps kickstart the whole clotting cascade to form a more stable fibrin clot. So, platelets equals plugging a hole. Now, for the NCLEX, you absolutely need to know the normal platelet count. Drum roll, please. It's typically 150,000 to 450,000 platelets per microliter of blood. Say it with me, 150,000 to 450,000. Burn that range into your brain. What happens if the count is low? Below 150,000? That's called thrombocytopenia. Think penia, meaning deficiency. If you don't have enough platelets, what's the biggest risk? Bleeding. Your patient might bruise easily, get nosebleeds, have petechiae, those tiny red or purple spots, or even experience serious internal bleeding. Your key nursing interventions? Bleeding precautions, soft toothbrush, electric razor, avoiding unnecessary injections or IV sticks, monitoring stool and urine for blood, and protecting them from falls. On the flip side, what if the count is high, above 400,000? That's thrombocytosis or thrombocythemia. Too many platelets can make the blood sticky, increasing the risk of unnecessary clotting. This could lead to things like DVTs, pulmonary embolism, or stroke. Nursing care here involves monitoring for signs of clots, encouraging hydration, and potentially administering prescribed antiplatelet medications. So, quick recap. Platelets are tiny fragments for clotting. Normal range, 150,000 to 450,000. Low count, thrombocytopenia, means bleeding risk. Use bleeding precautions. High count, thrombocytosis, means clotting risk. Monitor for clots. You've got this. Knowing your platelet basics is key for safe patient care and for crushing that NCLEX. Keep studying hard. You're doing great. Catch you in the next review.